Hi everyone, my name is Mojca Remskar and I will discuss with you the physician selection process in anesthesiology at the University of Minnesota. I believe good physician treats the disease, however, great physician treats the patient who has the disease. And that is where different attributes that we look at become very important. In the current process, we have cognitive attributes and non-cognitive attributes. On the cognitive side, we have a couple of objective measures, such as multiple choice question tests and transcripts, and subjective measures, such as letters of recommendation and faculty interviews. On the non-cognitive side, we only have subjective measures, such as standardized questions, letters, personal statements, and faculty interviews. Clearly, there is an absence of objective measures for non-cognitive attributes. Situational judgment test is an objective measure of those. It measures conscientiousness, aspiring to excellence, integrity, accountability, teamwork, patient-centered care, and stress tolerance, all very important to the practice of an anesthesiologist. We therefore created a study where we wanted to explore utility of situational judgment test in the selection process and look at where to find the balance between the objective measures for cognitive and non-cognitive attributes in the selection process, as both are important. Our study determined the following. It is relatively easy to administer situational judgment tests, so there's not an obstacle to implementing this. It takes about 45 minutes on a tablet task. And as we were weighting situational judgment test to a different degree, from 0 to 100%, we determined that in the range between 0 and 40, there is quite a bit of movement of resident rank, either upward or downward. If situational judgment test was weighted more than 40%, it became the dominant factor in the determination of where the resident would be ranked. So we believe that the weight should be somewhere in between the 0 to 40, depending on how much importance we want to give to non-cognitive skill sets of a resident. So in conclusion, SJT is easy to administer, it's well received by applicants, and it should be weighted somewhere between the 0 to 40%. I believe that it should be given as much weight as possible to be able to really identify great physicians who treat patients who have the disease and not just the disease. Thank you for your attention.